Hey all, this is Professor Elliott. We're going to cover chapter 13, which is central nervous system stimulants. So when we think about the central nervous system, this is your brain and spinal cord. So these drugs are going to affect really everything in your body, but a lot of them are kind of affecting your awareness overall. So here's a picture of your central nervous system with your brain and your spinal cord. Drugs within this category impact kind of overall, some of them are specific to these, but impact these neurons. So neurons are cells within your brain, nervous system really overall. And these neurons have receptors for excitatory neurotransmitters that are stimulating. So when we think about neurotransmitters, look at the first part of that word. It's neuro, brain, nervous system, and then transmitters. So these are basically chemicals within your brain that are really important. So you'll hear these throughout this lecture and throughout next week, but you need to know dopamine, norepinephrine, and serotonin. So these are all things that have an impact on our whole body, but they do a lot of things for us mentally and psychiatrically. So let's talk about our central nervous system stimulants. It's important to know the adverse effects. And studying these drugs, we want to categorize as much as we can, right? Because there's so many drugs. I would argue impossible to know all of them, but it is possible to know the categories. And so if we think about this chapter, which is stimulants, almost all of our adverse effects look like what happens in our sympathetic nervous system. And this is our fight or flight system, right? I always say if a bear is chasing you, right? I don't know where you're going to go, maybe Canada. If a bear is chasing you, your body is going to do everything to keep you alive. And that's why we have this system. Sometimes things like school stress and, anxiety about going to a big event, they look like the same thing. So this system kind of tries to keep us alive, but sometimes it's kind of annoying. So let's look at the adverse effects. They're just the effects of the sympathetic nervous system, because a lot of these are the adverse effects of the drugs we're going to talk about. So we have inhibited saliva production. So we get a dry mouth. Our heart rate accelerates. So we feel our pulse gets stronger. We may, our pulse gets faster, but we also may feel our heartbeat stronger. Our blood pressure can increase. So overall, we get more stimulated. So we take all of this and we can treat 5 different things. So the first thing we can treat is attention deficit hyperactivity disorder. So this is ADD or ADHD. Now this can affect anybody throughout the lifespan, but we see it a lot more in school-age children, especially boys. So when we give these stimulant drugs like amphetamine or methylphenidate, they actually make the child or the adult able to focus more. It's able to sit still, pay attention, complete tasks on time. Narcolepsy is the next thing we can treat. In narcolepsy, people just fall asleep. So a lot of times it's kind of manifested as this excessive daytime drowsiness, but people can just fall asleep. And then they could have this cataplexy or acute skeletal muscle weakness. So acute just means it's happening right now, and skeletal muscle weakness. So, they can fall onto the floor. They can fall really suddenly because all their muscles are giving out. The next one is obesity. And the stimulant medication, there's 2 medications we'll talk about, phentermine and orlistat. So phentermine is a stimulant medication. Orlistat, your book authors just kind of lumped it in there because it is a weight loss drug. But these drugs as a whole are stimulant medication, decrease appetite. Because think, a bear's chasing you, you don't need to eat. right? Your body is creating its own energy for that. You're not going to stop and have a sandwich. So we harness that for obesity because it decreases our desire to eat. The next thing we treat is a migraine, and this medication works a little bit differently, but the migraine is it's a severe headache, excuse me. It's a severe headache that's typically one-sided. It pulsates. With this headache, we are sensitive to light, sensitive to sound, can't really go to work, can't do anything. It's pretty debilitating. So the medications we give actually constrict the blood vessels. We get vasoconstriction. That's how they treat the headache. And the next one, it's neonatal apnea. So it's babies who aren't breathing. So we stimulate them to wake them up and help them breathe. All right, so let's talk about drugs for ADHD and narcolepsy. So ADHD and narcolepsy, we can kind of treat in the same way. So amphetamines, brand name Adderall or Dexedrine that you may have heard of, these drugs increase alertness, decrease drowsiness, elevate mood, and here are your neurotransmitters, your excitatory neurotransmitters. We increase dopamine and we increase norepinephrine. So as you can see, right, increased alertness, decreased drowsiness, elevated mood, those all sound like good things. And that is what makes our amphetamines Schedule II drugs, so really high potential for abuse. All right, contraindications. What is a contraindication? It means do not give, okay? So obviously if somebody's allergic to something, we're not going to give that to them. But then cardiac abnormalities. So why, if somebody's heart is not doing well, why do you think that an amphetamine would not be a good drug for them? So if we look towards those adverse effects, we're going to increase pulse and increase blood pressure like we talked about. So that is going to put a strain on our heart. So if somebody has cardiac abnormalities, we don't want to further strain their heart, right? In a normal, healthy person, I don't want to say normal, but in a healthy person with no cardiac abnormalities, that increased pulse and blood pressure isn't going to be significant, okay? So if we look at the adverse effects, right, these come from our sympathetic nervous system. If we look at those, it makes sense when we think of those contraindications. All right, the next thing, this is just a really important thing to know because it's a contraindication for so many medications. So it says an MAOI in the last 14 days. So when you looked at chapter 16 before class, the MAOI is a monoamine oxidase inhibitor. So this is a medication that we use for depression. What this medication does is it makes things like dopamine, norepinephrine, and serotonin more available in our brain. That really helps with depression. The thing is, if somebody's taken an MAOI, more dopamine, norepinephrine, and serotonin are going to be available in our brain. So then we take an amphetamine and we make dopamine and norepinephrine more available. So we have an excessive amount of dopamine, an excessive amount of norepinephrine. We know all of those things are excitatory. And we know things that are excitatory can increase our blood pressure, increase our pulse. So if a patient has taken an MAOI, monoamine oxidase inhibitor, in the last 14 days, when they take an amphetamine, we are going to see a hypertensive crisis, so really high blood pressure. 14 days is typically the magic number. If an MAOI just does not play well with others. But if a medication has a contraindication for taking an MAOI, it's typically always within the past 14 days. And you're going to see that pretty exclusively throughout this week's lecture. So adverse effects. This is a stimulant, right? We talked about how it activates the fight or flight system. So we see increased pulse, increased blood pressure, and then anxiety and insomnia, so decreased ability to sleep. All right, next one is methylphenidate. These are brand names Ritalin and Concerta. This again is a Schedule II drug, and it has all of the same stuff as the amphetamines. So on your drug card, we could do a whole class for medications for ADHD and narcolepsy, but your methylphenidate, you know, has all of the same things as amphetamines. Okay, so atomoxetine or Strattera is a drug specifically for ADHD. So this isn't something we use for narcolepsy. So atomoxetine or Strattera is not a scheduled drug. So it does not have the abuse potential. It doesn't have addictive properties, which is awesome. So this is going to stimulate norepinephrine exclusively, but we know norepinephrine is stimulating, so we can see anxiety, increased pulse, blood pressure, headache, GI upset is with a lot of meds, cough, and then we can see actually erectile dysfunction because that sympathetic nervous system, we could see that with that. Okay, this drug does have a black box warning, and I have in here that it causes suicidal ideation in adolescent patients. So a black box warning is something the FDA puts out, and it says something really, really significant that could really harm the patient up to the point of death can happen. And so suicidal ideation, somebody explained this as suicidal ideation is the heart attack of the psychiatric world. So suicide is a very lethal thing, right? So atomoxetine has a black box warning for suicidal ideation. If anything has a black box warning, you will want to know. Next drug, this is specifically for narcolepsy. It's called modafinil or Provigil. So we can use this for narcolepsy, but we can also use it for obstructive sleep apnea. That's when people stop breathing in the middle of the night when they're sleeping. And then shift work disorders. So this is somebody who works night shift and just can't wake up, so drowsy, but they have to work night shift. Modafinil could be something they get. So the action of this drug, it works by decreasing GABA. So GABA is actually a calming neurotransmitter. So we've been talking about all of these excitatory neurotransmitters, but GABA is a calming neurotransmitter. So we actually decrease that calming effect and it makes your patient more awake.